let's go right across to Saurabh Gupta. New rules for hospitals and the amount of distance that can now be kept in between beds. Saurabh, what are we hearing?
Well, obviously Mumbai is short of hospital space, and you see these new constructions happening to build more hospitals. But within the existing system of medical, services, the hospitals that are already treating COVID patients, perhaps they need to accommodate more patients. Now, earlier there was a lot of distance in these COVID wards, but now what the government has done, or what the BMC has done, is that they've reduced the distance between bed to accommodate more beds and create more capacity, because Mumbai expects cases to rise exponentially. And this is not because of any other issue, but because of the kind of city Mumbai is. It's a city that's got slums where social distancing is practically impossible. It's also a city where in the slums water supply is low, so washing hands is not is possible in many cases. So there will be more cases in Mumbai, and this was something that authorities had anticipated all along. But now what they're doing is they're reducing gap between beds, and since patients are already infected who are coming into these wards, COVID wards, and the hospitals are only catering to serious patients, asymptomatic patients are being dealt with elsewhere, more hospitals are being built, and the capacity will go up to 76,000 beds in the months to come, as Mumbai expects the cases to go up there. So this is of course something that the authorities are doing. In the last 24 hours, 1,500 new beds have been added, and Mumbai government hospitals, all 250 COVID ventilators are in use, and private hospitals have also been asked for beds, along with the fact that Mumbai is preparing for cases to rise exponentially. Perhaps it could go all the way up to 50,000 if medical experts are to be believed. But interestingly, what authorities also say is that we will have to learn to live with the virus, and thereby we have to make these adjustments to ensure that everybody who needs treatment at a hospital gets treatment.